nonprofit organization. Our goal is to help BIPOC families and communities, is where we specialize in providing comprehensive mental health resources, um, doing community initiatives to promote mental well-being for all. And our research aims to advance racial equity by addressing mental health disparities and identifying those gaps in access to care for marginalized communities. Mortality and morbidity rates in New Jersey only continue to increase. There is not enough light and conversation around afterbirth and the trauma from experiencing morbidity or the traumas from experiencing infant or maternal mortality by a loved one. And so here at Peaceful Minds Haven, not only are we here to educate, unite, and bring resources to our communities of the BIPOC community, but we are also here to help break barriers and also begin to dismantle the stigmas around seeking help and asking for help when you or a loved one is experiencing postpartum depression, or even knowing how to identify what that might look like. Depression, a lot of times people seem to feel like it might look like a dark room and sadness, but sometimes depression could be anger and come out in other forms. And so Dr. Stephanie Hack is going to shed some light on those topics for us. So we have a few more folks who have joined us. So I'm going to go ahead and get started. Good evening, everyone, and welcome to Peaceful Minds Haven. Where am I identifying postpartum depression? And this series features the incredible Dr. Stephanie Hack, also known as Lady Parts Doctor. We're thrilled to have her join us tonight for what we know will be an informative, supportive, and empowering conversation. Tonight's session is all about shedding light on postpartum depression, a topic that is often misunderstood and under-discussed. Dr. Hack will guide us through recognizing the signs and symptoms of postpartum depression, understanding the emotional and physical changes that occur after birth, and helping us identify where we are or where our loved ones might be in the postpartum journey. So hopefully everyone who has joined us tonight will leave feeling equipped with tools for awareness, self-compassion, and support. And whether you're a new parent, a supportive parent, a professional working with birthing individuals, or any other realm of this vital work, there is something valuable that you can take away from this conversation. And once again, welcome and thank you for being here. Together, we're breaking stigma and creating space for healing and growth. And without further ado, it's my pleasure to introduce our guest and expert-led speaker, Dr. Stephanie Hack.
Hello. Good evening, everyone. Thank you. I'm just sitting here waiting for you to show my camera, just listening, enjoying everything that you're saying. And then I was like, oh, wait, it's me. So everyone, thank you so much for joining us from this. Hello, Tiffany. Thank you very much for joining us for this very necessary, very important conversation. And I would like to thank all of the women of Peaceful Minds Haven. Thank you very much for providing a space for us to have this conversation because, much of how we are educated about things is from our families, from our friends, from our mothers, the mothers and birthing people around us. So it's important that we talk about things like postpartum depression among many, many other maternal health issues. So thank you very much for having me here to talk about this. And so you sent me a series of questions, and I want to make sure that I address these questions, and I have some notes. So I'm just going to kind of go through them, and I don't know, do you want to ask the question and do you want me to respond? Are you
However,
gonna?
however you feel comfortable. I'm more than happy to kind of moderate the questions if that's helpful for you, but I'm just here for the information, whatever you're comfortable with, Dr. Hack.
Okay, it's fine. Then don't worry, relax. And
Oh,
you gave me the question, so I will just read them. But again, I am a board certified OBGYN. My focus now is on education because education is my passion, and also education is much of what is missing. Either our providers, usually they don't have the time, especially when you're going to see your OBGYN, to sit during a doctor's visit, which for us is 20 minutes usually. And there's a lot to talk about. And in that 20 minutes, all of your needs won't get addressed. So often what we find is we are missing important information or we aren't asking the important questions. And I wanted to have an opportunity to talk more about all of these things: postpartum depression, miscarriage, menopause and perimenopause, period information in general. And so I started the Lady Parts Doctor podcast, which you can find on my website, ladypartsdoctor.com. And then that just kind of evolved in to the blog and just creating some general health information resources, and also being able to show up for things like this to continue the conversation and put my feet to the ground. So I'm going to go through this list of questions. They're excellent. And I think that you will find that almost everything that you want to know, they have already asked. But if you do have a question, there will be a period of time at the end for us to kind of go over any additional questions you may have. So let's get started. First question is, what are the most common signs and symptoms of postpartum depression that often go unnoticed? And what are some ways partners or loved ones can identify signs of postpartum depression and provide support? And I love this question because one, when you are going through postpartum depression, you may be unaware, and it may be first apparent to those around you because after you have a baby, you're just
Ah,
trying to make sense.
training.
Yeah, you're trying to make sense of everything. Like first, what just happened to me? But then two, what's going on with my body? And then three, what is going on with this little person that I'm now adjusting to, who's also adjusting to me? So you're concerned about so many different things. It's nice to have somebody who's kind of on the outside looking in, because you might not be the first one to identify those signs. So, first thing of common unnoticed symptoms, some emotional symptoms like being very irritable or having increased anxiety or sadness, which is masked as fatigue or stress. So, those are some of the first things. I know some of you might be like, that's how I felt when I was pregnant. And that's an excellent point because often postpartum depression or perinatal depression can express itself during pregnancy. So it's about, I believe, 27% is before pregnancy, about 33% during pregnancy, and about 41% postpartum. So you may be already demonstrating those symptoms. Other things could be physical, like unexplained aches and pains, low energy, or just changes in your appetite and sleep beyond new parent exhaustion. And, unexplained aches and pains, well, that's also kind of hard to identify, right? Because after you have a baby, you're uncomfortable, like your whole vagina vulva situation is going to be potentially uncomfortable if you've had a vaginal birth. If you've had a cesarean birth, you're going to have abdominal pain that's uncomfortable. Your pelvis and your hips and all of that are probably uncomfortable just from carrying a baby for all of those months and all of the changes in your ligaments and tendons from the hormones. So noticing that, but increase in addition to some of these other signs that we're going to discuss. Other things would be behavioral, like withdrawal from family or friends, or just being less interested in activities that you used to enjoy doing. And last, some cognitive things, some mental things like having difficulty concentrating or making decisions. Everybody remember to mute your microphone, please. And persistent guilt or feeling like a failure as a parent. And we're going to kind of come back to that one. We'll come back to that one. So, how can your partners or loved ones help? And there are a few things that they can do. So, the first thing that we mentioned is they can observe by just being aware of changes in your mood or behavior, especially if they go beyond 2 weeks postpartum. and communication. So creating a safe space to talk about what you're going through just by expressing concern without judgment. Without judgment. I have to add that part because sometimes, we should work on our tone a little bit, but being able to express the concern without judgment and say something like, "Hey, what's going on? Is there anything going on?" versus like, "What's going on with you?" And encourage help. So suggest seeking professional care if the symptoms worsen or persist. And then, of course, provide practical support. Everybody comes and wants to see the baby. The baby, how's the baby? But providing help like household tasks, cleaning. I remember reading, I saw a post on, maybe it was Threads, it was something on social media. Someone said, when I had my baby, my friend came over and she cleaned my house for me. They did my laundry for me. They did like, some of these tasks that when you have to do them on top of everything else, leave you feeling really overwhelmed. It's just having someone who can come in and, the food is helpful too, but like not just food, some of the basic, not sexy stuff that you still need help with. And also baby care and just giving you time to rest. So we touched on this a bit before, but we're going to talk a little bit more about it now. How does postpartum depression differ from the baby blues? And when should someone seek professional help? 80% of women and birthing people experience baby blues. 80%. That means like just about everybody that you talk to is going to have that experience. I know I had that experience. I have three children who are 2, 4, and 6. And I remember with my second, everybody remember to mute your microphone. With my second child, I just remember sitting on the toilet and crying. And I couldn't explain what it was. I couldn't explain why, but just that's baby blues. You might cry for no reason. There's not anything particularly wrong, and you can't quite explain it. Um, the symptoms include tearfulness, mood swings, anxiety, and fatigue. Somebody's mic is still on and we can hear you. So, can everybody just take a moment and check and see if you are muted, if you're chatting?
I've just muted everyone, Dr. Hack. I apologize.
Oh, okay.
Thank
Thank you.
Yeah, you're welcome. I'll
No
keep an eye on
problem.
it. Thank you.
You're welcome. So, postpartum depression versus baby blues. Postpartum depression affects about 14% of postpartum women and birthing people. And it's going to be persistent sadness, lack of interest in activities, extreme fatigue, and the possibility of or thoughts of self-harm. And there's a very specific DSM-5 criteria for it. It is persistent for 2 weeks, these symptoms, and one of them has to be at least depressed mood or having lost interest. And it includes the things that we talked about, the insomnia or decreased appetite. Someone may lose weight because they're not eating. The inability to concentrate and focus on a task, feelings of guilt, feelings of unworthiness, those feelings. Like I think whenever you become a mother-like figure, there's always feelings of guilt that you just have automatically, and that is worsened. And the feelings of, would anybody notice if I just were to go away? I'm not a very good mother or parent. So these are all things of postpartum depression, and they extend longer than baby blues, and the symptoms are more severe than baby blues. So when do you seek help? You seek help when the symptoms interfere with your daily life or bonding with the baby. So that's another symptom, just not being able to bond with the baby. If you have any thoughts of hurting yourself or hurting someone else, and then if the symptoms persist beyond 2 weeks or worsen over time. And that can be a hard one because you're not really, you may not want to share with someone, hey, I'm having thoughts about hurting myself. I'm having thoughts about hurting the baby. And that's why we need to create safe spaces to really check on one another and find out how we're feeling and feel that we can share. Are there specific risk factors that make someone more likely to experience postpartum depression? Yes, and we're going to break them into different categories. So, first, there are biological risk factors. Things like a personal or family history of depression or anxiety makes you at increased risk for postpartum depression. If you have hormonal imbalances like thyroid dysfunction, that will increase your risk. And if you have complications during pregnancy or childbirth, and I think that is one of the most common things that I hear when someone says, "Hey, had postpartum depression and I had a really traumatic childbirth." And we grossly underestimate. Now, this is just me going off script for a moment, but I think we grossly underestimate the trauma that is experienced during childbirth because it's a situation where you care very much and you don't have as much control. You don't have a lot of control over your body all of the time, at least in the current system. It's not the same everywhere. And that increases the ability for you to feel out of control and to lead to some traumatic experiences. Other factors include psychosocial things like a lack of social support, intimate partner violence or abuse, stress from financial instability, not feeling like you don't have enough money, or just challenges in your relationship, and a history of trauma, things like adverse childhood experiences. So basically, anything that causes stress. And then environmental risk factors like socioeconomic disadvantages or experiencing racism, unplanned or a higher risk pregnancy, and then having a baby with medical issues, like a baby that needs to go to the NICU, the neonatal intensive care unit. So let's talk about how physical changes during and after childbirth can contribute to postpartum depression. So things like hormonal shifts, sleep deprivation, who isn't sleep deprived after having a baby, physical recovery from delivery, all of these things play a major role in postpartum depression. For example, with your hormone changes after delivery, your levels of estrogen and progesterone drop dramatically. You don't have the placenta anymore making hormones, and that contributes to your mood being mood instability, your mood not being as stable as it was before. Then also, you add in the physical recovery part. You can have pain or complications from your delivery. Let's say you have a cesarean section, or maybe you have a vaginal tear, like a second, third, or fourth degree tear, and that really requires a significant amount of recovery. All of these things can prolong the physical recovery, and it can lead you feeling really frustrated and isolated and in pain as you're kind of managing your whole postpartum journey. Sleep deprivation. When you don't get enough sleep, like you don't, do you get irritable? We all get irritable, right? And that's when you're missing sleep, maybe just for one night. So when you have multiple nights in a row, if your baby doesn't have any issues with colic or anything like that, it often takes 6 to 8 weeks for them to start sleeping maybe 3 to 4 hours of a night. And then if you add in a baby who maybe has some additional issues or some colic or is cluster feeding and you're nursing, then you have multiple nights in a row where you're not getting sleep. I remember when I was in full time practice, one of the other doctors had a baby who would not nurse during the day, just wouldn't nurse during the day. And this is like after 6 months postpartum. And the baby would not take a bottle during the day, but would only nurse at night when her mother got home from work. Well, you can imagine she's really sleep deprived. So you have that disrupted sleep, it exacerbates fatigue, makes that worse, and it just makes you more vulnerable to mental health challenges. And then body changes, weight changes, breastfeeding related changes, body image concerns, all of that affects our health. You are seeing a new version of you postpartum, and you don't always like it. And it takes some time to adjust and begin to feel like yourself. So all of those things can really contribute. So, what role does the hormonal fluctuation play in postpartum mental health? So, the sharp decline in estrogen and progesterone, as we kind of touched on before, really disrupts the mood regulating systems in the brain, and that increases your risk of depression and anxiety. Some people get postpartum thyroiditis, which can mimic depression and depressive symptoms like fatigue and mood changes and irritability. And how can families and communities work to reduce stigma and create a supportive environment for postpartum individuals? Um, First and foremost, as we are having here in this space, we need to have open conversations. We need to discuss or normalize discussing mental health, particularly during pregnancy and postpartum. We need to normalize just being able to say, hey, I'm just having a hard time right now. This isn't easy for me right now. I need help. Education also. So educating ourselves, but also educating our family members, our friends, and our partners about the signs of postpartum depression. And all of that will help improve early detection. What's the practical help? We mentioned that before as well, offering assistance with household tasks or baby care to alleviate maternal stress. Just providing an ear to listen or a presence, an extra set of hands in any way that is needed. And there are, having community programs as well, support group meetings, online communities. I think one of the things that I think that every mom and birthing person needs to have is a group of friends who are also parents who just have a chat, just an open chat that you can always drop into and share something. I know it's a little anecdote, but I have one. I still have it to this day. My youngest child is 2. I had to message them today because I had a guilty mom moment. My child had 100-year celebration at his school, and I didn't have him dress up because I was like, I just have a lot going on and I don't have time to pull a costume together. And I felt guilty when I went in and I saw all the kids. But having that group of very supportive friends who are just like, hey, you're still a good mom. Things happen. You're overwhelmed. It's a lot. Everybody needs to have a group of supportive friends who have shared the experience and just can kind of listen and be non-judgmental and support you as you're going through postpartum. And then advocacy, being able to challenge stigma by promoting campaigns that emphasize that postpartum mental health struggles are common and, most importantly, treatable, because too many postpartum mental health conditions are either undertreated or untreated for all of the reasons we discussed before, and some reasons that we're going to discuss coming up. And that leads to a lot of issues. It leads to issues with the parent, with the mom or birthing person. It leads to issues like not seeking adequate medical care, worsening of medical conditions, and then it also leads to issues for the baby. And you can have outcomes like preterm delivery or stillbirth or small for gestational age or a low birth weight baby, just a number of things. So, how do we treat postpartum depression and what options are available? The There are a number of things, but the main thing is going to be psychotherapy, having cognitive behavioral therapy and interpersonal therapy, and they're very effective for mild to moderate postpartum depression. So just because you have postpartum depression doesn't necessarily mean that you will need medication, but you at least need to start with therapy. And they focus on managing the negative thought patterns and improving communication and overall coping. There are medications. So the most common ones are SSRIs, selective serotonin reuptake inhibitors, and they're commonly used with safety considerations for breastfeeding mothers. And then lifestyle changes. So regular physical activity can also help reduce symptoms, but also getting out of the house. I know some of us, I'm included in this. Like after I have a baby, I hold myself up in my house, and I actually never really wanted people to come by because I just always felt like I had to do something. And then if someone came by, I was going to have to entertain and do something for this person. But getting out of the house makes such a big deal. So also getting out. And then your treatment effectiveness, how effective the treatments are, just depends on how early they're diagnosed and how much you adhere to whatever the treatment is. And most people are going to see improvement within weeks of starting. Are there any holistic or non-traditional methods that are recommended for people who are managing postpartum depression? You can do mindfulness and meditation, and that's proven to reduce stress and improve emotional regulation. Eating healthy and good nutrition is always, always good. Acupuncture, there's some emerging evidence that suggests that it could alleviate some depressive symptoms in postpartum people. And then peer support groups, online or in person, just being able to connect with someone else, another parent, helps reduce the isolation and the stigma. So, what are the most significant barriers preventing women and birthing people, particularly those in underserved communities, from accessing care for postpartum depression? There are so many. First, just the stigma. Fear of judgment prevents many people from seeking help. I mean, you have a baby and you're just supposed to know what to do, and you're just supposed to instantly love your baby, and you're supposed to instantly bond with your baby. And, we're a newer generation where we feel more comfortable talking about these things, but maybe you're talking to someone from an older generation and these things weren't talked about as much. And so you're afraid of being judged for expressing these feelings. Also, very important, cost. So, not having insurance or high out of pocket expenses can make care inaccessible or feel inaccessible. Lack of education, not knowing the symptoms of postpartum depression to be able to seek care. And then, of course, when you think that you have it, maybe not knowing what to do after you've diagnosed or become concerned that you or someone you love may have postpartum depression. And then geographic barriers, always just being able to access care, physically get to someone who can provide care for postpartum depression. And then lastly, cultural factors. Just some cultures view mental health struggles as a personal weakness. And so you might be afraid to seek treatment for that reason. So, how can healthcare providers and organizations better support individuals facing these barriers? A few things. So, one, integrating care. So, to make mental health services part of routine prenatal and postpartum care, we should screen. And typically we do, at least in OBGYN in our practices, we screen antepartum, before the baby during pregnancy. And then also we screen postpartum. And also we should screen at well women visits to catch those who have mental health disorders prior to becoming pregnant. Also, telehealth. So, telehealth services can reach underserved areas and make care more accessible for those who can't access care physically. And education, promoting awareness about postpartum depression symptoms and resources, webinars such as this. Thank you very much, ladies. And lastly, collaborative care models. So there are different programs that to help mom provide real-time psychiatric consultations for obstetricians. So to educate providers as well. And if you think that you might be experiencing postpartum depression, the first thing that I would say is to just reach out and tell someone. Tell someone that you trust. You can start with telling a friend or a family member that you trust, and then a trusted healthcare provider about your symptoms and what you've experienced. So I said, in my office, I used to screen patients postpartum, but even sometimes people they wouldn't screen positive, but they'd say, I feel depressed. And my feeling was, if you are telling me, if you can communicate, I feel depressed, you would benefit from some therapy. I mean, I believe everybody benefits from therapy, but especially if you're able to communicate postpartum. And then also screening tools like the Edinburgh Depression Scale can gauge the severity of your symptoms, and support having relying on your support network, and sharing your feelings with them. That could be a partner, family member, or a close friend, just so you feel less isolated. Now, are there any strategies or habits that new parents can adopt during pregnancy or postpartum to help reduce the likelihood of postpartum depression? Well, you remember that we talked about the psychosocial risk factors, the lack of support. So, building a support system is golden. It is so important. And that is establishing a network of family, friends, or professionals before the baby arrives. If you have a history of a mental health condition, and you are not seeing a therapist during pregnancy, make sure you reconnect with a therapist during pregnancy because you want to be locked in for postpartum. Also, prioritizing self care. I say this and it's sometimes I laugh, but it's so important, but it almost feels laughable to say for someone who is postpartum and feeling overwhelmed by all of the things to do. But that is why I always highlight, and at Lady Parts Doctor, I say where healthcare is self-care. If you get in a good practice of self-care, when you become overwhelmed by anything that happens in life, you are already at least practicing self care to some extent. And that is a way to help you cope with whatever you're going through. So, rest when possible, eat nutritious foods, engage in light exercise, make your doctor's appointments. And when it gets very difficult and it's overwhelming, your self care might not be as extensive as it was maybe before you were pregnant or before the baby came. But practicing a little something for yourself is just a subconscious way of reinforcing, hey, I'm important, I matter, I deserve to be taken care of. And with that, set realistic expectations. So avoid perfectionism. You're not going to be perfect, nobody is. And focus as much as you can on bonding with the baby rather than meeting the external pressures. Every relationship is different, even between you and your children or child. So just try to be as present as you possibly can and enjoy this experience. Don't worry about what somebody tells you it has to be or it should be like, because your experience is beautiful, it is important, and more importantly, it is yours, it is unique. And then, of course, as you already are being here, educate yourself, learn about postpartum depression to recognize potential symptoms early. So, if you, again, and I think I didn't specifically mention this, but of course, if you haven't had a history of postpartum depression, you are at a much higher likelihood of having postpartum depression in a subsequent pregnancy. So, a couple of things that I did not touch on. That I want to come back and share with you just to remind you. So, postpartum depression, as I said, affects about 1 in 7 women and birthing people. That's a lot. But we're not talking about the partners in this scenario. So, some research was done and they found that postpartum depression affects male partners as well. And I'm saying male partners because that's who the research that is the population that they researched. And I'm looking for the exact statistic because I want to come correct. 10 to 12% of male partners also experience postpartum depression. And similarly, the highest prevalence is within 3 to 6 months. And so it peaks postpartum depression at 2 to 6 months for women and birthing people, but also in the partners, it's about 3 to 6 months. So important to know. You might also be looking for symptoms in your partner and noticing these changes in the partner. So as you educate yourself, you will also be able to assist them. Lastly, I'm just perusing to see if there's anything else I want to share. Yeah, so the duration. So, as we said, it typically peaks at 2 to 6 months for moms and birthing people, but it can last for over 7 months and 25 to 50%. And then for some, it goes beyond a year. That's a long time. And I think we've covered the main things. So, I'm going to come out of these questions and I don't know if any questions were posed in the chat, but do you think, Jasmine, it's a good time to go through some questions?
I did see a couple that were in the chat. You covered
Okay.
baby blues versus depression. Let me see. Oh, someone said, I really wish I had this kind of information and support after I had my daughter. We
Mhm.
appreciate that. We really do. Here's a question. But you covered it sort of.
We listen
Is
and
it
we don't
possible?
judge.
Yeah, we listen, we don't judge.
We don't judge. We listen. And if we're
Okay.
judging, we keep a straight face and we don't say anything about it. We just listen.
Poker face. A question: is it possible that postpartum depression can last 4 years and or beyond?
Well, if you're that long out, that's probably, it may just be depression. So, depression is very common and and you have a higher risk of developing postpartum depression if you already have a history of depression. So, if you're experiencing depression 4 months after having had a child, that is probably just depression. Not that there's a
So,
significant, the treatment will be similar.
so we're looking at that the latter part of your previous answer to one of the questions. Postpartum can last past a year. So we're looking maybe at
Mhm.
that 2 year mark. We should start feeling better.
You should start feeling better, but if you're not, right, you could be developing depression. And there are, for some people, the mental health issues don't present until they're pregnant. And there are so many. We're talking about postpartum depression. Anxiety goes almost hand in hand with postpartum depression. And let me see if I have the specific statistics about anxiety. No, I don't have specific statistics about anxiety in my notes here, but mental health conditions, so that's all of the mental health conditions, um, they affect 1 in 5 women. So that's in birthing people. So that's 20%. And that can include OCD. We said anxiety, depression, bipolar. We didn't talk about postpartum psychosis. Postpartum psychosis is fortunately very rare, but it is incredibly severe. It occurs in about 1 to 3 in 1,000 births. And postpartum psychosis is accompanied by delusions, hallucinations. And those are the cases where you hear people who have perhaps committed suicide or they have killed their children. Now, perinatal and mental health conditions are the number one cause of maternal mortality. And the CDC notes that these are all preventable deaths. So the number one cause of maternal mortality is preventable. Yes. Oh, okay. So I'm looking now. Um, I'm going back to the questions. Let's see. Bianca, I
Let's
see all of your wonderful questions. I'm looking. Did you see some before Bianca's questions at the end?
just the one that I uplifted. I retyped it out. Is there any advice that you would give to couples versus just the mother?
Yes. So I'm I think having an honest conversation before the baby comes, like first being educated about these signs and symptoms, and just creating a space to be able to say, hey, if I say this, it means I need help. Because I think that's the hardest thing to ask for is I need help. And just creating a safe environment to be able to say that, but then also kind of having a plan so that that you both, but especially your partner knows if I am experiencing this, this is what I need you to do, and kind of creating that plan. So, once you get to that point, if you get to that point, you already want to have a plan in place that you're both comfortable with. And so you can just kind of put it in action. You're going to have a lot going on when you have a newborn, a neonate, or an infant. And just being able to have a plan, I think, is the best thing, and being able to speak openly and honestly. So, good communication. That's like always the best advice for couples. And it's no different with postpartum depression.
We have Tynisha. Tynisha asks, Are the symptoms the same in the partner? And how do you open a conversation with the partner showing signs of postpartum depression?
Yeah. The symptoms will be the same. hmm And then because these are symptoms of depression. And I think it's always good to start with just a, hey, how are you feeling? Hey, we have a lot going on. Are you okay? I think that's a good entry point. We have a lot going on. How are you managing this? How are you feeling with this? And being able to just relate and sharing your experience and giving them a space to just kind of talk and just listening. I would start there.
And then we have Sophia. How do we encourage mothers that may be experiencing symptoms to seek help when they have fear of the healthcare system, viewing them as an unfit parent? You hit the nail on the head because this,
Yeah.
go ahead, Dr. Hack.
No, go ahead. I'm agreeing with you. I'm just a vocal
No, no,
agreeer.
no. Oh, yes, that is a great question, and I need the answer too. So I'm ready.
I mean, I wish it was just like a nice, easy answer for that, but that is um, such a poignant question in our changing times. The the first thing that I would say is to, if at all possible, find a healthcare provider that you trust and start there. Because if there's someone that you trust, then they can help you navigate, you know. If I would say start there. Now, there are other resources. There are resources like the Maternal Mental Health Hotline, but you won't know those people. There's an organization that I really like, Postpartum Support International. I'm sure you've heard of that. They have resources and online support groups. So finding yourself in an organization or like a support group like that and navigating to find providers that can assist. I think this is the kind of thing that ends up being word of mouth because I agree with you. Um, the fear of people viewing you as an unfit parent in a point that in a way that matters, like you might try to take my children away, that's a real fear. And I can't tell you something that will make you feel easier about that, but starting with a healthcare provider that you trust, I would say start there, whether that is your doula, if that is your midwife, if that is your nurse or NP, your OBGYN, just start with that person to try to help find um, assistance navigating.
I
Yes, that's a great answer. And continuing to join circles such as Peaceful Minds Haven. Yes, because you will find providers through word of mouth as well.
providers, you'll find your tribe, you'll find like-minded women, and you'll find that you're not alone in this space. And you'll
hmm
you'll be able to open up better. It has truly helped me. I had my son 18 months ago, and so to hear you say that the postpartum should be shifting, and it could possibly just be kind of shifting into full depression, girl. So for me, I'm still in my healing stages, which has the reason PMH was birthed. Um, Experiencing morbidity during my birth where I was near death, and couldn't meet my son until I was 8 months old because I was internally bleeding for over an hour after saying, I don't feel good, I don't feel good. And then I'm declining, and everything's just kind of going south. And that's where we get into the systemic healthcare system and not being heard as Black women in this space. When we say it hurts,
hmm
say it's not right, listen to us. We know what we're talking about, and no, we don't have a high tolerance of pain. And so, you know, just saying that, I encourage everyone on this call, don't take it all on and say, I got it, I got it, I got it. It's okay to get help, and it's okay to speak up. And it's important to be heard and be listened to. My birthing experience left me having to need over 2.5 liters of a blood transfusion and an emergency surgery to even stop the internal bleeding. And so this conversation is very dear to me. And I hope that, and I know there's so many other birth moms and women on this call that can identify to my story or identify with the questions and the answers that you provided. And we're thankful for the space. We're thankful for the community. And to what guest asked that question, Safia, if you are a loved one, um, is untrusting of the healthcare system, please find your tribe, find a space such as this. It doesn't have to be PMH. It could be another organization, but um, find that safe space. It's going to be important during that healing time.
Definitely. And since we're on this topic, um, it is so important that we are able to develop trusting relationships with our healthcare providers. It is so necessary because really when you go into your birth, like you have a team and you need to really feel that whoever it is that is assisting with your birth is aligned with your interests, is aligned with your outcome. And so I just have to mention that it's just really important that you have a team that is collaborative and aligned for what you want, as much as you can build that team for yourself.
Absolutely. Do we have any more guests that want to come off of their mute and ask Dr. Heck a question, or maybe type your question into the chat while we still have a few more moments? Tiffany?
Yes, I was being nice. But so thank you so much for sharing this. I'm I'm surrounded by a group of women that are from all different backgrounds of all ages and stages within their lives, from infants, they're either from pregnancy to like they've got grandbabies, you know what I mean? And this is really important information because it helps someone like me who is not going through it be able to help those around me. Um, Getting this education and the awareness of what to look for, those signs, and then we can pass that on because for those of us that are not going through it or may not have gone through it, um, we're very important in that village, right? Because we're the ones I feel like that are charged to help however that is. So thank you. I think everyone, no matter what stage you are in life, especially us women, we need to educate ourselves about these topics. And I'm so thankful for Peaceful Mind Haven, and I'm thankful for you, for being able to share what you've shared so far. And I'm also hoping, that we can lean on you for other topics that are really important, especially like I said, when we think about all of the different stages and phases that we are all in right now in this room. Some people are going through postpartum depression. Other people are going through perimenopause or menopause, you know what I mean? And we have that range. So I think we all need to come back no matter where we are in our own personal journeys so we can hear those stories and educate ourselves.
Yes, you're welcome and thank you. You are right. And again, that's why these conversations are so necessary because when we know, then we can share, with those around us and we can pass on the information. If you really want the information to stick, we have to be able to hear it, pass it on to those around us. So I agree.
We do have another question that came through. When someone has experienced a miscarriage, is it still considered postpartum or is it grief? Just a,
Mm,
just
you
a
know, I I'm gonna say that if you have a loss after, so a miscarriage is up to 20 weeks. Anything before 20 weeks is considered a miscarriage. And then anything after 20 weeks is considered a pregnancy, like a preterm pregnancy loss, or, pregnancy loss. So I mean, it's all grief. And I feel like I'm gonna make it so nuanced, and I think it's just nuance, honestly. I think the care is going to be the same, the way it's kind of addressed. Now, if you have a pregnancy loss before 20 weeks, is someone going to give you that same, like if you've had a pregnancy loss at 8 weeks, it's unlikely that someone's going to give you a postpartum depression screening form to complete it. But yes, if you have a loss at 25 weeks, that will be considered postpartum. They'll give you. So I think that is at 20 weeks, I would say is the cutoff. After 20 weeks, they'll consider that postpartum. And then before 20 weeks will be considered grief. But still, the way that it's addressed will be very similar.
great questions and interactions in the chat. Another question came through: feeling isolated and getting easily upset, getting overwhelmed. Are they signs of postpartum depression? Not sure if you mentioned this. And yes, we did cover this at the top of the call, but Dr. Hack, if you're happy to kind of uh, revisit, I think it was question number 1 or 2 was early on.
Sure, they
When you
can
joined
be.
a little late.
Yeah, they can be signs of postpartum depression. Um, if you have those feelings along with feeling just a feeling sad, feeling depressed, or just not getting as excited about things that you used to do. So the very specific criteria for postpartum depression is having within a 2 week period persistent not feeling sad or not feeling as excited about things you used to be excited about, with an additional at least five other symptoms, which can include the feeling isolated, the irritability. That's what I'm going to say. Getting easily upset would be irritability and overwhelmed. In addition to, a couple other symptoms that group together and that continuing would be considered postpartum depression. Now, if you have just those by themselves, that might not be considered postpartum depression.
And another question: can you have delayed postpartum depression that happens after you wean from breastfeeding?
So the way we currently define postpartum depression, it presents within the first year. So if you're experiencing, maybe it depends on how long you breastfeed. If you're breastfeeding 18 months and you stop and then you're feeling depressed, then that won't be considered postpartum depression, at least by the current criteria. Mhm.
Great questions.
Yeah, they're great. You just keep coming with them, but they're wonderful questions. I know are really benefiting people who are observing the webinar.
Yes.
And on ladypartsdoctor.com, on my podcast, or Lady Parts Doctor, it's available everywhere. I talk about a lot of these things, and I have a lot of conversations. I have some podcasts about postpartum anxiety and postpartum depression, um, miscarriage and pregnancy loss. I am a board member for an organization that focuses on assisting those who've experienced stillbirth and infant loss and pregnancy loss in general. And I have a podcast conversation with the founder of that organization who experienced a stillbirth at 36 weeks. We talk about a lot of these things. So I encourage you to go peruse Lady Parts Doctor. It's the podcast, and you'll have more extensive extended conversations about some of these topics. I also talk a lot about matrescence and that experience of becoming a mother and going through it because for much of, I'm going to be celebrating the third year of the podcast in March. And for the first year that I did the podcast, I was pregnant. And then the next 2 years, I was recording postpartum. So there are a lot of conversations. We'll talk about some of these things as well.
Yes. Can't wait to check out the podcast too, to Shonda. I also uplifted Dr. Hack's website link to Lady Parts Doctor in the group chat.
Thank you.
Feel welcome to check that out. Her website is it's great. It's informative. Can you access the podcast directly from the website?
You can. There's a tab, but even on the front page, you can see, I think the latest episode is out. The last one was about things you need to know about cervical cancer prevention at every age. So, yeah, it should be on the very first page, but there's a link where you can access all the episodes as well. Mhm.
Wonderful. And so I just also want to flip that I did share PMH's website, but the link that I did share will take you directly to our subscribe page where you can sign up for our emails and continue to receive resourceful information. We send out our newsletter monthly, and you'll be able to keep up with events such as tonight's that we host. We have a few upcoming events that you can check out on our calendar of events page. We have some webinars, virtual events, in-person events. So we encourage you all to kind of just check it out. We are here to be a resource hub and a safe space for everyone. We listen, we don't judge, and we're trying to find our tribe too. We're building, we're healing, and why not heal together? Why not create those circles of trust together on this journey? Dr. Heck, did you have anything to add before I close out?
Just that you can also subscribe to ladypartsdoctor.com. I have a newsletter that I try to send out monthly. I have just not been in like the most excited space over the last 30 days or so to send out my January newsletter.
That's
but
okay.
but it's
You're
coming.
doing great.
Oh, thank you. But yes, please come. We're as many of these spaces as you can find. It is hibernation weather. It is. Protect your mental peace and your joy. It's just that kind of time. But yeah, I just want to say thank you very much. I'm very happy to be invited to have this conversation, to have another opportunity to promote women's health.
Thank you so much, Dr. Hack. We are looking forward to
You're
doing another
welcome.
collaborative virtual event, and we hope all of you will join us. Have a great evening, and thank you for being here for this vital conversation. Have a wonderful night, everyone.
Thank you.